Course, Pollution and Health. Module 3, Urban Health. Salutogenic Cities and Therapeutic Landscape Design. Developed by Andrea Rebecchi, Department of Architecture, Built Environment and Construction Engineering, DABC, Politecnico of Milano. Lesson 3.2 Design Strategies from Literature. From the literature, first of all, before going to research experience, I would like to show to you this important literature review that we developed 4 years ago. And we were asking the literature, so to the scientific communities and case study, what we can consider environmental risk factors. And we detected those 8 environmental risk factors that are soil, air, noise, and light pollution, the urban heat island effect, urban safety and security, and lower attractivity of the places. Those environmental risk factors cause this kind of non-communicable disease like obesity, diabetes, respiratory disease, cardiac disease, and cancer, allergies, and also mental disease and mental disorders like stress condition, anxiety, cognitive development, disease, sleeping disorders, and social exclusion feelings. So, those are the non-communicable diseases and the mental health disorder caused by the environmental risk factor. What can we do? Of course, we cannot delete completely the environmental risk factor, but we can reduce them through those 14 healthy design strategies and urban health strategies that are green, blue, and grey infrastructure, the biodiversity protection, the adverse meteorological event management, intermodal public transport system promotion, but even the vehicular traffic reduction and the promotion of a walkable environment, and then social mix, functional mix, urban solid waste management, active renewable energy system into the outdoor furniture of the cities. But even outdoor space lighting and outdoor shading of the places, and finally, the universal design that go further, the regulation for cognitive and physical impairments, trying to promote a city that is carrying all the needs of the population. In the next input, we will see 3 research developed by our Design and Health Lab. The first tool and research experience that I would like to share with you, it's about walkability. It's a tool for measuring the propensity of the built environment to promote physical activity and to promote a walkable and a cyclable environment. The tool, as you can see, is divided into a macro phase and micro phase of assessment, and it's a weighted system with each criterion. We have 7 criteria, and each sub-criteria, we have more or less 20 sub-criteria, are weighted into a global system. Let's go to see what the criteria means. Macro dimension, it's an archival phase, and it's a quantitative assessment that looks at the city from the top view, and it's capable of assessing 1.5 kilometers square, more or less, with a quantitative purpose. So, all the data are archival. We have design, density, and diversity, and it speaks about quantity, so it means the number of the cities. The micro dimension, instead, it's more observational, it's more qualitative, and it explores the street section of the city. And the quantitative phase, so the macro dimension, was repeated to the whole cities of Milan, and we can see here the result. Of course, dark blue means a more walkable environment, according to the criteria that I previously mentioned. Instead, the light blue means the places that are suffering in terms of walkability and cyclability. Our purpose was not to make a ranking of the different neighborhoods, but was to understand where we have weaknesses and where we have strengths. Of course, the weaknesses should be improved, and the strengths should be considered like best practices for the city of Milan. And neighborhood by neighborhood, we were capable of making some consideration and suggesting some improvement. And this is another table with the density, diversity, and design data. As well, another experience just based was about the city of proximities. And even in this case, we explore the proximity from distance, if it is a point, if it is a destination, and from concentration, if it is a surface. Like pedestrian areas, cyclable lanes, it's impossible to measure them like a point, and so they should be explored as a concentration. Those are the 17 input layers that we were capable of detecting. For example, pedestrian surface, cycle routes, bus, tram stop, metro stop, green spaces, of course, kindergarten, elementary school, middle school, co-working spaces, cultural facilities, sport facilities, pharmacies, and all the networks related to territorial health care, medicine, but even newsstands, municipal markets, and urban gardens. So, those input layers were examined, even referring to the urban chances of the city of Milan, and we were capable to understand which is the average of population in Milan that live in a condition of hyper-high proximity. That means from 0 to 400 meters, from a medium-low proximity, that means from 400 meters to 800 meters, and to a medium-low proximity that goes to 800 to 1,200 meters. As you can see in the further slide, we were able to detect the population of Milan that lives in a position of proximity. Till the final map that again doesn't have the aim to make a ranking between different neighborhoods, but just to understand where the city of proximity is already established, and instead where are the places that are suffering in terms of proximity. And so the municipality, the policymaker, but even the designer should improve some action to bring proximity even in those spaces, because again, proximity is in favor of physical activity, and physical activity is a tool to promote and to reduce sedentary and obesity. This is like a complete overview of the best practices of the best neighborhood in which we can find the best practices to translate and to export in other parts of the cities. Both from the walking point of view and from the cycling point of view. We can see the best accessibility to destinations. Again considering the walking proximity in Milano. We can see the walking proximity, the cycling proximity, and the residential density. The third research is about the urban green spaces availability. First of all, we went to detect the proximity of those green spaces, considering all the green spaces, but later we read and we understood together with the World Health Organization that a green area should be bigger, more than 15,000 square meters, and should have a function inside, and this is the same map considering all the meaningful green areas. And you see that the situation is completely different, and even the number of the population are lower if we are considering the green areas that has got a meaning, that has got a function, that they can be attractive for the population. Here you can see the city of Milan, and the distance 250, 500, 750 meters in terms of availability of nearby urban green spaces. And here you can see the city of Milan, and the distance 250, 500, 750 meters in terms of availability of nearby urban green spaces with surface greater than 15,000 sqm. At the same time we did a qualitative assessment using a tool from Spain that is called Recital, and it is capable of measuring and to assess a qualitative aspect like accessibility, facilities, amenities, aesthetic conditions, and more criteria related to the usefulness and the safeness of the places. Here you can see that the situation is a little bit different, because from the quantitative and qualitative point of view, we were capable of understanding park by park, green area by green area, which is the situation, and what we need to improve. Which kind of aspect we needed to improve to reach a good balance in terms of quality and efficiency. That is another tool that we drafted for the local health authorities, and it is the assessment tool for urban plans. It has been adopted in Italy. They should assess the urban plans, and so again 7 macro areas with 20 criteria, speaking about environment, soil and subsoil, sustainability and hygiene of the built environment, urban and social development, mobility and transport, and outdoor spaces quality in general. This tool is supporting the local health authority to express feedback to the new local plan. Even in this case, it's a weighted system that can detect when an urban plan and where an urban plan is suffering to help the designer to improve it, to reach urban health strategies coherencies. With a low, moderate and high coherence to the urban health strategies that we were speaking about before. And this tool was even taken into consideration from the Ministry of Health and from all the regions in Italy, like a key tool to develop better coherence of the urban plan with the urban health strategies. And the last minute of this lecture will be about some key messages. So, the first one is about the World Health Organization in 2020 that says that the concept of public health moves from a medical, that means individual approach, to a social, that means a collective approach, strongly influenced by the environmental, economic, cultural and educational issues. The second one is by Haas, and it says that the urban health and healthy building research topic will use a quality quantitative assessment tool, and they are moving from a prescriptive approach, that means based on regulation, to a performance approach. And the final one, healthy experience-based urban planning and design strategies should be considered from the early stage of design, action and urban planning action as a primary health prevention policy and strategies. Thank you very much, and those are my contacts to be in touch for further interest.